This is lab 21 on the dog specimen. So today we're continuing in that hind limb to do some pelvic limb nerves and then just a couple of little vessels. So we're going to start inside the pelvis so I can show you just a couple of things. So keep in mind that all the nerves we're seeing are coming off the lumbosacral plexus, which you're not actually going to see, but it's down in this area where all of those nerves are coming out. So that would be the lumbosacral plexus. There's diagrams in your book to see that, but you're not going to dissect it out because it kind of destroys everything down here. I will point out while we're here the lumbosacral trunk, which we won't get to until a little bit later in this lab, but it is right here. So that would be the lumbosacral trunk, and I'll explain more about that a little bit later. And then here we have the obturator nerve. So obturator nerve is then going to go through the obturator foramen, so you're going through and coming out over here. So you're coming out in the adductor muscle. So here you can see little branches from the obturator nerve coming out. I'm just kind of arborizing there in the adductor. Alright, then we'll move on to the femoral nerve. So that one, if you kind of pick up your femoral artery here and kind of move it out of the way, you'll see femoral nerve right here. It's actually coming out of that iliopsoas muscle. This is femoral nerve right here. So femoral will continue here, and then we're finding this branch coming off. And this is the saphenous nerve. So saphenous nerve is going to run down and follow along your saphenous artery. So following along right here with this artery is the saphenous nerve, continuing all the way down here. Alright, then we're going to flip the dog over to the lateral side. And we're looking for the pudendal nerve. So here you've already done your reflections of your gluteals here, so it should look something like that. And you're going to dig in this ishiorectal fossa back here in this fat and fascia. And you're also going to be careful. There's the sacrotuberous ligament here, which I have cut, but if you're going to cut it, you need to watch out for some of these nerves that are right underneath. So just be very careful in that area. Alright, I'll try and hold these out of the way. So the pudendal nerve that we're looking for comes out kind of underneath this caudal gluteal artery, and you'll see it going caudally here. So pudendal nerve. Then the pudendal nerve is going to give off a few things. So we have a caudal rectal. If I can pick these up here. So caudal rectal should be this one. It will go into that external anal sphincter muscle. So caudal rectal. And then you'll have some perineal nerves coming off. Let's see. So these should all be perineal nerves right here. And then this larger continuation will be the dorsal nerve of the clitoris. So here you can kind of follow it down as far as you can, but this will be dorsal nerve of the clitoris since we have a female. In the male it will be dorsal nerve of the penis. Alright, then we'll move on to that one of those little nerves that I talked about being right under the sacrotuberous ligament, and that's the caudal cutaneous femoral nerve, which is this little guy right here, going to the caudal aspect of the thigh there. So caudal cutaneous femoral nerve. And then, so that lumbosacral trunk that I talked about when we were inside the pelvis is actually going to be coming from right here and is giving off this craniogluteal nerve right here. So following along your craniogluteal artery, craniogluteal nerve, and then you have a caudal gluteal nerve here, and that will go into superficial gluteal. Sometimes that one gets cut, so you may have a little bit harder time finding that. And then we're going to follow the sciatic nerve, which should be the big one and the easiest to find and follow. So sciatic nerve here, and you follow it along distally, and you just cut open your biceps femoris. So we should have transected and reflected biceps up here, but if you just split it right down the middle and open it up, you should be able to follow that nerve all the way down. Alright, so sciatic nerve here, and then it will break into the two components. You have tibial component here, so tibial nerve right here in the forceps, and then a common fibular component, which is going to be this one right here. So common fibular, tibial, And then you have these tiny little nerves that come off of each side of those. So off of the common fibular component, you're going to have lateral cutaneous sural nerve, which is this little guy here. And then off of the tibial component, you will have the caudal cutaneous sural. So that's just this little thing here. And those oftentimes get broken, so it's okay if they do. And then we're just following this common fibular just a little ways. And so you're looking to follow it down and look where it branches into a superficial and a deep fibular. So you have superficial fibular nerve will be here, and you can see it's kind of running superficially here all the way down. So superficial fibular nerve. And then you'll have a deep fibular nerve. So deep is going to dive deeper down in here. So deep going here. Deep fibular nerve. Both of those coming from common fibular nerve here. Alright, and then we just have the continuation of the cranial tibial artery. So cranial tibial artery was here, and we kind of lose our injection, which is unfortunate. But you'll follow cranial tibial along, and you can cut all the muscles and retinacula that are in your way to do this. But you're following this along, and as it crosses over the joint here, it becomes dorsal pedal artery. So dorsal pedal at this point, and dorsal pedal will give off an arcuate artery, which in this dog is pretty tiny, but it's right there. Arcuate artery, and then a perforating branch. So perforating branch is this one right here, and it's diving in between the metatarsal bones. So you see the perforating branch, it dives through, and if you take out some of this interosseous muscle, you can actually see it coming out right here. So that's that perforating branch. And that should be it for Lab 21.